the question is, can a teenager understand the lifestyle changes that'll occur after surgery? And, are they really at a level of maturity to accept that and want those changes? Because, bariatric surgery does limit what you can do in terms of eating. If you're in college or high school, say, you're gonna look a lot different than the people around you if you're only eating a baby-sized meal. People will notice the drastic changes. The other thing about teenagers is, their metabolism tends to be more flexible than, say, like a 50 or 60-year-old. So at that point, you ask the question, do you want to commit a young person to having a surgery that they could potentially not need if they just, change their overall lifestyle habits? Because, if you've noticed, teenagers can eat like a whole pizza and, get away with it. That's not something an adult can do. And we did also talk about, the tendency to addictions as well. So if you're a young person and you have not been exposed to, the world, what the world has to offer in terms of addictions and vices, and then you put a kid in a position where they've had this surgery and their odds of getting addicted are higher, then is that really, serving them in the overall? If, their diet habits are poor, if they're not exercising, and they've never tried that before, I would obviously say, spend about 4 to 6 months with a low-carb diet, take out all the sodas, get regular exercise without injuring yourself, obviously. And if there are big improvements in your weight and your health, then surgery may not be necessary. If you do a very good diet and exercise well for 4 months, 5 months, and you're still dealing with, say, like diabetes, and your weight hasn't changed much, then you may be at a point where really bariatric surgery would be very helpful to you.